I'm Dr.Aditya Khemka, a joint replacement surgeon specializing in hip and knee surgery. I practice out of Prabhadevi in Bombay and work out of multiple hospitals in Bombay like Hinduja, Bombay Hospital, and Wokad. Today, I would like to talk to you all about a few points about musculoskeletal health. And my effort is in order to improve your musculoskeletal health. And by the end of the talk, one should be able to carry out simple tips in life in order to live a much healthier life. So, the first and the most important topic that we talk about is what is this importance? What is the importance of musculoskeletal health? Health plays a key role to keep up good mobility and dexterity in an individual, along with enhancing their ability to work and actively participate in all aspects of daily routine life. Good musculoskeletal health is very, very crucial in order to maintain not only functional independence, but also an economic and a social independence across their lifespan. Physical activity has a crucial role in reducing the risk of other factors as well as non communicable diseases. And it can only be achieved with adequate musculoskeletal health. And here I'm referring to syndrome X or obesity. So, what is the relationship between musculoskeletal conditions and a reduced capacity to engage in physical activity? Essentially, if one will be sedentary and one will not be able to participate in physical activity, what really happens? It can lead to acute as well as chronic pain, causing physical limitations, proceeding in loss of participation, and withdrawal from social community, occupational activities, as well as reducing the quality of life and well being, including mental well being. Impaired musculoskeletal health leads to substantial personal, community, as well as societal consequences, particularly in the geriatric population. A stronger relationship between the painful musculoskeletal conditions, lack of physical activity, and resulting functional decline, frailty, loss of well being, as well as loss of independence. It actually can lead to depressive symptoms. And I've seen multiple patients come into my practice with such symptoms, can lead to severe problems. An individual with arthritis and various other disorders is much less active than an individual without one. Thus, a regular physical activity emerges as the most prevalent risk factor associated with functional decline. Most importantly, such impaired musculoskeletal health causes reduced capability like grip strength, like walking speed, like getting up from a chair, like standing and losing their functionality and imbalance. And all this has slowly been linked to increased mortality. Thus, weak musculoskeletal health is a component of frailty. Now, what is this impact? To what extent can it affect a human being? The impact is now recognized globally with an increase in morbidity as well as a mortality risk related to it. Good health is crucial for maintaining an active, productive, and prolonged working life. With an increase in global retirement age, maintaining good musculoskeletal health will become increasingly important for older workers as many occupations and work related activities are associated with muscular disorders like low back pain and shoulder disorders. And this pandemic of COVID in the last 2 years, in my practice, has brought around so many people with multiple shoulder and lower back problems who never had these problems before. And all these problems are actually related to them being sedentary. Thus, it is important as an orthopedic surgeon for me to identify and implement effective interventions for people with musculoskeletal conditions. But more importantly, it is important for people to themselves identify these problems and become more productive at work. High income countries like European countries as well as the United States observe musculoskeletal conditions to be one of the major causes of work loss and hence resultant in workers' compensation, early retirement, and loss of retirement wealth. While developing countries see musculoskeletal conditions to have a major impact on livelihoods because musculoskeletal conditions like low back ache actually keep the person at home and then he cannot go to work, and daily wage workers or workers who are actually earning meager salaries who cannot get leave from their work actually suffer a great loss of productivity and economic loss to the society at all levels. Since these conditions are chronic, painful, and associate disability and social disengagement, they also cause mental problems because it's all a vicious cycle. Hence, quality of life related to health is known to be greatly impacted in persons with multiple morbidities. Unfortunately, this impact is greater when it comes to arthritis, low backache, and shoulder issues. So, what is the burden that the society is feeling? This currently is what is known or classified as non-communicable diseases. They account for most of the global burden of disease, with musculoskeletal conditions being the leading contributor. Developing countries, as well as developed countries, recognize the transition between this burden to long-term disablement. However, low and middle income countries are also demonstrating enormous future impact, especially a country like India, which is actually developing. They are actually responsible. So, a majority of the population is between 20 to 45 years, which is a work related population. So, because of this population growth, because of this aging, musculoskeletal conditions like low backache, shoulder pains, arthritis are increasing with sedentary lifestyle and becoming the commonest risk factor. It is estimated that by 2050, there will be 5 times rise in people of over 40 years living in developing countries, contrasting the wealthier countries. Additionally, obesity becomes an important risk factor for various conditions. It is hypothesized to rise dramatically in the developing world over the coming 2 decades. As you already know, India somehow has become the diabetic capital of the world. Furthermore, increased use of motor vehicles is not only reducing physical activity but also increasing the numbers of motor vehicular accidents, releasing in various disorders. So there was a time when one used to walk to school, one used to take public transport, but the increasing availability and the reduction in cost of physical and car transport, people are finding it much easier to travel in a sedentary lifestyle, in a sedentary manner. They get out of the house, they get into a car, get into the office, back into the car, and back at home. So, what is the role of physical inactivity and sedentary behavior in musculoskeletal health? Sustained and systemic urbanization in developed countries has led to sedentary behavior, particularly in younger people. So, for example, my father was way more active than I am, unless I go to the gym and exercise. His father was way more active than he is. And actually, this has been the progressional change in behavior over generations. The rapid growth of lesions like video games, social media, movie streaming, binge watching seems to be the prime contributor. This surge in sedentary behavior is not only a major risk for many chronic diseases, but also recognized as a substantial economic global burden. Increasing physical activity and optimizing exercise, as recommended by most organizations, including the WHO, is an optimal way to improve health. Evidence shows that the effects of sedentary lifestyle, example, desk job, can be reduced by a small amount of activity every day. And actually, small amount means a few minutes. A recent meta-analysis for more than 1 million individuals, it was said that 1 hour of moderate level daily activity can eliminate the increased risk of death associated with 8 hours of sedentariness. Thus, a moderate level of physical activity remains a key requirement. Sedentary behavior is not only a major contributor to musculoskeletal health, but it is also a major contributor to obesity as well as diabetes. It also leads to osteoarthritis, and several epidemiological studies have confirmed this link. Evidence has also said that increasing levels of physical activity will not only improve this health, but reduce the risk of suffering from obesity-related diseases such as diabetes. So, what is the WHO recommendation on physical activity? I would generally recommend nearly 2 hours per week of moderate physical activity, or about 20 minutes per day of any kind of physical activity is recommended by the WHO. This activity can simply mean walk in the corridor of the house or walk in the corridor outside the house. Actually getting fresh air at early evening times and late evening times and early morning times is very, very important. So one of the key aspects which I have seen in my practice and I advise is after a meal, just have a 20-minute walk every day. This will elevate heart rate and lower the lifetime risk of cardiovascular disease. Apart from rendering health benefits, improvements in respiratory fitness can be achieved by changing sedentary behavior with a simple low intensity physical activity like walking. Exercise is now widely prescribed for the rehabilitation of musculoskeletal injuries. and its use as a preventive health measure is now widely investigated, with guidelines around the type, frequency, and duration of activity being considered, which can be absolutely anything of your choice. Focus and actually a mix and match is very, very important. So, focusing on your health becomes extremely important. So, what are these evidence based interventions for musculoskeletal conditions, which actually cause the increase in disability adjusted life years? Low backache, neck pain can be benefited by staying active and exercising regularly. Group exercise programs or weight loss support can also be considered, because walking with a friend or in groups actually keeps you active and interactive, as well as gets you aware of social problems, as well as practical issues, as well as improves your skeletal health. To reduce the incidence of falls, improve balance, strength training, home hazard assessment, participation in falls prevention programs, getting involved in activities like simply gardening, dancing, etc. is helping. Osteoarthritis has been shown to benefit from various activities and exercises that improve muscles and aerobic fitness, like walking, swimming, weight loss support. And that's what I tell all my patients. Medicines may help you to a certain extent, but what will help you more is physical activity. So, the association between healthy aging and physical exercise. See, one has to age. Aging is inescapable, but it can be made easy and healthy with the help of exercise. And I would like to give example of one of our most common actors is Akshay Kumar. He actually keeps himself healthy with the help of exercise, and it doesn't look like he's aging. So exercise renders many benefits to aging body, including reducing manifestations of aging, especially the aging phenotype of the elderly. A recent review concluded that physical exercise renders a positive impact on muscle mass and function in healthy subjects 60 and above, and by improving muscle performance by increasing the ratio of type 1 to type 2 muscle fibers, and it improves the muscular strength. Similarly, various bodies and task force have recommended higher protein intake in combination with physical exercise, especially in postmenopausal women, especially to overcome menopausal associated diseases like osteoporosis. Additionally, fragility risk associated with osteoporosis can be decreased by following a proper and a marked exercise program. It also leads to reduction in inflammatory markers. Furthermore, exercise and mechanical loading also have a positive impact at the molecular, cellular, and tissue levels. Like with aging, the potential for cell proliferation and number of stem progenitor like cell diseases in tendons can induce increase in tendon collagen synthesis and improve muscular strength and tendon strength. So, what is this relationship between obesity and these disorders? A surge in sedentary behavior and unhealthy diets. So, it need not be a slice of pizza or a burger on one day, but a regular unhealthy diet caused by global obesity epidemic, along with a sharp rise in diabetes. These risk factors for cardiovascular and degenerative diseases, which further complicate the management of arthritis. Obesity is an important comorbidity of various conditions and one of the most common health issues. There are strategies based on reducing obesity in adults as well as improving and alleviating the pain in such conditions. Interestingly, it is one of the most modifiable risk factors. Exercise and weight loss have benefited overweight and obese adults with knee OA in various clinical trials. So, reduction in 1 to 2 kilos of body weight in a typical patient can improve the patient's well being dramatically. What are the consequences of childhood obesity and physical inactivity? So, lack of physical exercise in childhood, and that is very important because we have a very young population in India, further leads to muscular pain in later life. Does reducing obesity in children by keeping your students or children active. So, this is very important that previously at my time, playing down or playing down in the compound of the building was very, very important for 4 to 5 hours every day. But nowadays, I've seen a large number of kids are actually stuck to their video games, stuck to their social platforms, as well as iPads for a prolonged period of time, as well as consumption of healthy diets and sedentary lifestyle is contributing to childhood obesity. Low in nutritional value and high in caloric content foods further contribute to obesity and type 2 diabetes. Is diet also a part of healthy living? Yes, of course. Diet is inevitably the most important part. A 3-year follow-up study about 400 adults show that diets which are high in potassium, which is available from simple fruit and vegetable intake, reduces the amount of muscle loss in adults over 65 years. I have such patients coming after 65 and 70 in the geriatric population that I cannot do anything with medication because they have been suffering from a loss of muscle mass. So dietary intake, which is flavonoid intake from fruit and vegetables, is also known to be positive correlation with bone health, especially in perimenopausal women. That's around 40 to 50 years. Improving the diet in osteoarthritic patients have also shown great benefits. Vitamin D, calcium, protein consumption, other substances like glucosamine, MSM, as well as collagen intakes have improved patients' musculoskeletal health dramatically, along with high intake of long chain fatty acids, vitamin D, and vitamin K, helps in mineralization of bone and cartilage. Antioxidants, which are rich diet, may benefit athletes by improving tissue repair. Therefore, the moral of the story today is that activity and physical exercise will improve your musculoskeletal health to an extent where one can actually live a beautiful quality of life in their elderly age group. So the moral of the story is exercise, good diet, not only when you have a problem, but in order to prevent the problem. Thank you so much to Dr. Reddy's to provide me this opportunity to talk to you today regarding musculoskeletal health. I hope a little of what I say makes a difference to each and every one's lives who's listening. And I hope these comments make an impact on somebody's lives. Thank you so much.